Diverticulitis is a digestive condition characterized by the inflammation or infection of small pouches, called diverticula, that can form in the walls of the large intestine, or colon. These pouches are common, especially in people over the age of 40, and typically form in areas where the colon's inner lining has weakened. The presence of these pouches is referred to as diverticulosis, which is not necessarily problematic on its own. However, when one or more of these diverticula become inflamed or infected, the condition is known as diverticulitis. Causes and risk factors. The exact cause of diverticulitis is not entirely understood, but it is believed to result from increased pressure within the colon. This pressure can cause weak spots in the colon's lining to bulge outwards, forming diverticula. Several factors can contribute to the development of diverticulitis. Age. Diverticulitis is more common in individuals over 40, with the incidence increasing with age. About half of people aged 60 and older have diverticulosis, though only a portion will develop diverticulitis. Diet. A diet low in fiber and high in processed foods is considered a significant risk factor. A lack of fiber leads to constipation, which increases pressure in the colon and can contribute to the formation of diverticula. Obesity. Being overweight or obese increases the risk of diverticulitis, likely due to the added pressure on the digestive system. Lack of exercise. Physical inactivity has been associated with a higher risk of developing diverticulitis, as exercise promotes regular bowel movements and reduces pressure in the colon. Smoking. Smoking is another risk factor, as it has been shown to increase the likelihood of developing diverticular disease. Medications. Certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and steroids, can increase the risk of diverticulitis, as they can irritate the lining of the intestines. Symptoms. The symptoms of diverticulitis can range from mild to severe. Common symptoms include abdominal pain. This is the hallmark symptom of diverticulitis, usually occurring in the lower left side of the abdomen. The pain can be sudden and sharp and may worsen over time. Fever. An infection in the diverticula often causes a fever, as the body tries to fight the inflammation. Nausea and vomiting. Digestive upset can occur, leading to nausea and occasional vomiting. Changes in bowel habits. Diarrhea or constipation may occur, along with a feeling of incomplete bowel movements. Bloating and gas. Individuals with diverticulitis may experience bloating and excessive gas due to the inflammation in the intestines. In severe cases, diverticulitis can lead to complications like abscesses, perforations, fistulas, or bowel obstructions, all of which can be life-threatening if not treated promptly. Diagnosis. To diagnose diverticulitis, a healthcare provider will first perform a physical examination, checking for tenderness in the abdomen. Blood tests may be ordered to check for signs of infection, such as elevated white blood cell counts. Imaging tests are crucial for confirming the diagnosis and assessing the extent of the condition. A CT scan is commonly used to visualize the diverticula and any complications like abscesses or perforations. In some cases, a colonoscopy may be performed after the acute phase of the disease has subsided to examine the colon more thoroughly. Treatment. Treatment for diverticulitis depends on the severity of the condition. For mild cases, treatment can often be managed at home, while more severe cases may require hospitalization. Antibiotics. If the diverticulitis is caused by an infection, antibiotics are often prescribed to treat the bacterial infection in the diverticula. Pain relief. Over-the-counter pain relievers, like acetaminophen, may help alleviate the pain. However, nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen should be avoided as they can worsen the condition. Dietary changes. In the early stages, patients may be advised to follow a liquid diet to allow the intestines to rest and heal. As symptoms improve, a gradual return to solid foods, starting with low-fiber foods, is recommended. High-fiber foods are usually reintroduced once the inflammation has resolved. Surgery. in severe cases, or when complications like perforations or abscesses occur, surgery may be necessary. A common surgical procedure for diverticulitis is the removal of the affected part of the colon, resection. In some cases, a temporary colostomy may be performed. Prevention. While diverticulitis may not always be preventable, certain lifestyle changes can help reduce the risk of developing the condition or minimize its severity. Eating a high-fiber diet, a diet rich in fruits, vegetables, and whole grains helps prevent constipation and reduces pressure on the colon. Staying hydrated, drinking plenty of fluids supports bowel regularity and reduces the risk of constipation. Regular exercise, physical activity can help promote healthy digestion and reduce the risk of diverticular disease. Avoiding smoking, quitting smoking can significantly reduce the risk of diverticulitis and other gastrointestinal conditions. In summary, diverticulitis is a common but potentially serious condition that results from the inflammation or infection of diverticula in the colon. With early diagnosis and proper treatment, most people can recover fully. However, adopting a healthy lifestyle with a balanced diet and regular exercise is the best approach to prevent diverticulitis or manage its symptoms.
Thank you for watching. Please subscribe our channel.